Hi, I am Dr. Alexis Jude Dominic Xavier, Specialist Orthopedic Surgeon working at Aster Hospital Mankhool. Today I would like to use this opportunity to talk to you about what we call Congenital Talipes Equinovarus, or in simple terms, Clubfoot. It is a common congenital deformity seen in our children. It is supposed to happen about 2 cases per 1,000 live deliveries. It is a condition which thankfully can be very well corrected with the new modalities which we call Ponseti's method of treatment. It is a treatment where the condition is corrected by just casting and no surgery. Telling a few points about Congenital Talipes Equinovarus or Clubfoot. It is a deformity affecting the feet of the children. In about 50% of the time it occurs in both the feet, and it can be diagnosed as soon as the child is born by the parents themselves and by the pediatrician who is doing the neonatal survey. And also it can be picked up before birth at the 20th week ultrasound scan. And so the parents can talk to the gynecologist or the obstetrician, and they can have a discussion with us, orthopedic surgeons who are treating Clubfoot. And even before the child is born, the parents can be mentally prepared and come to an understanding, a realistic understanding about the problem and how well it can be corrected. So it happens in children who are born of breech presentation or whose mothers suffer from a condition called oligohydramnios, where the fluid inside the uterus is reduced. So the reason for this problem is, it can be of 2 possibilities. One is the genetic defect in the child's leg, or it could be the posturing of the fetus inside the uterus of the mother. So as soon as the baby is born, we teach the parents how to handle or how to do what we call passive stretching of the feet. And the mother, whenever she feeds the baby, she can passively stretch the feet. And when the child is little big, around 1 week, we start applying plasters. And every week we correct it little more and more and apply a new plaster. And by 5 to 6 weeks, the feet is corrected, and then we put the child on what we call Dennis Brown splint. The child will have to wear the Dennis Brown splint 23 hours a day, that is, except when the baby is having a bath, and all the other times they should put the splint on. The idea is not just to treat the deformity and correct it, but also to prevent the recurrence of the deformity. Suppose we feel the deformity is well corrected, but we stop using the Dennis Brown splint or the Dennis Brown shoes, which we use in the later stages, too early, then the deformity can recur. Present day, there is very good understanding of how the treatment has to proceed and to how long the splint and the shoes have been used. So it is a cause of no concern. Of course, the parents will be worried about it, but I use this opportunity to assure the parents that the condition is 100% curable and correctable.